So you or one of your family members has had a hip replacement or you're about to have a hip replacement. I think if you watch this video, you're going to feel a lot better about it. What's up, y'all? This is Carolina Doc PT, and today's video we're talking about having a hip replacement and those patients that are thinking about it or have already had it done. And I think that this video will help to put your mind a little bit at ease. Uh, Hip replacements are generally very successful. Okay, so the reality is the vast majority of patients will do very well in the surgery, the recovery, and in the entire rehab of having had a hip replacement. That's not to say it's 100%. It's not. Vast majority of patients, I would say on the order of 97, 98%, are very, very successful. Um, Usually, after a hip replacement, they are going to be successful because patients generally don't have a ton of pain. Some patients might have a little bit, so don't. So we're respecting those people as well. But usually, it is not an extremely painful surgery. Usually, it is not too hard to regain your strength and function, and usually, it is um, something that you should be able to return to your prior level of functioning or better uh, pretty quickly. So those the hip replacements that we generally see are usually very successful. Now, the things that are helping to make them a success are the 4 points that we're going to be going over here. So the first one of those is you want to make sure that you are following your hip precautions, whatever those are. So, in general, in our area, those hip precautions will break down into either being anterior or posterior. Yes, there are approaches like you can have a pure posterior approach that the surgeon is using to install the hip. It can be posterior lateral. There's an anterior lateral. We're getting lost in the weeds if we split hairs into the different types. In general, those classifications break down into anterior and posterior. And depending on the type of or the direction that the surgeon took to actually install your new hip, um, you're going to want to avoid the opposite motions because that's the direction that's the area where the surgery is going to be the weakest. Um, so for an anterior precaution, those are going to be motions of the hip, such as extending your hip. So having your leg go back behind you. That's another anterior hip precaution is going to be no crossing of the legs. And then there's also you're going to want to avoid external rotation of the hip. So that's where your leg and your toes are going to go towards the outside of your body. If it's a right hip, that would be your foot rotating over to the right. If it's a left hip replacement, then it's rotating over to the outside to the left. Um, so those anterior hip precautions, we are finding that surgeons do more anterior surgeries now, it seems, because those motions are very easy for patients to follow to make sure that they are not violating them. A matter of fact, well, not most, but several patients that in this area would even say that, once they discharge the hospital, you ask them, well, hey, what are your hip precautions? And they'll say, what hip precautions for anteriors? Because it so fits within a patient's lifestyle. So they're those are probably the easiest ones to recover from because just how often does a patient, kick your leg to the back to do extension motions, right? So um, the motions for anterior precautions are very easy to follow as long as you're not doing things like sometimes I'll talk to the patients about, say, taking big steps. So let's say you had a right hip replacement with anterior precautions. If you're walking and you take big steps on your left leg, then that is pushing your right hip into extension. So you want to kind of avoid that type of motion. You would also want to avoid, say, taking stairs two at a time with your left leg, say if you had a right hip replacement, because that's going to push that hip into extension. But in general, anterior hip precautions are very minimal because of the motions involved. Now, for the other type of classification for hip replacements, that's going to be a posterior hip replacement. Uh, as I said, that can be a pure posterior. It can kind of come more posterior lateral. In our area, it's more the posterior lateral. But again, the classifications and the difference between those two is minimal, and we're splitting hairs to even talk about it in this particular video. So for your posterior hip precautions, these are a little bit more difficult for patients. So main one is going to be no trunk flexion. So that would be like, say, bending over to pick something up off the floor after you've dropped it. Um, that would also be, say, if you're sitting down and you are reaching forward, say, onto a coffee table from a chair. So you're going to break that 90-degree angle of your trunk. So that's a motion that you're not going to want to do. Also, you're not going to want to cross your legs. And another anterior, or excuse me, posterior hip precaution would be internally rotating your hip. So that's where your toes and your whole leg rotates to the inside of your body. That's the other direction that you're going to want to avoid. Again, those precautions are in place because those are the opposite directions that the surgeon took to actually install your hip. So that's where things are going to be the weakest as far as healing. Now, a lot of times I'll get questions from patients where they'll ask, well, it's not just going to pop out on its own. The answer to that is no, it shouldn't. If it did, that is a catastrophic failure of the joint and the device, and you would need to talk to your surgeon about that. Because and maybe your attorney, I don't know, but that would be a complete catastrophic failure of the hip, and I've never seen that. Now, could that happen, say, if you were to have a fall and you were to, let's say you fall forward, you've had a posterior hip replacement on the right side, you put your right hip forward to catch yourself, your you you know your trunk falls forward from the shock of that fall, you're catching yourself with your leg, and your knee internally rotates and crosses midline with all of your body weight falling forward in a really fast jolting motion. Could that knock your hip out of joint very early on in the surgery or post surgery? Yeah, very well could. So um, you're not going to want to have any sort of a fall or anything. So that's is what's going to lead us to talking about our second thing. But before I do that, just to finish up on those precautions. So in general, these hip precautions are going to be in place for about 3 to 4 weeks normally, maybe out to 6 weeks. If there's been an issue with the surgery, maybe it would go out to, say, 6 months, potentially maybe even a year out. Occasionally, I've had patients who have had surgeries where there was a problem during the surgery, and their hip precautions were to remain in place for the lifetime of that particular patient. Um, that doesn't happen a lot, though. Usually, it's going to be probably in more that 3 to 4 to 6 week range, and then you should progress very well after that. But that's assuming again that we are staying safe within that process, and so that is number two most important thing for you to be following after this hip replacement, so it can be successful for you. And that's going to be using uh, well, staying safe basically is number two, and there are a few ways you can go about doing that. One is using the appropriate assistive device. um, so if well, not if, all patients, when you discharge from the hospital and discharge home, are going to be using a walker for your walking. You're going to want to use that for generally probably the first 2 to 3 weeks. Then you'll generally progress to a cane for like 3 to 4 um, maybe 5 weeks, and then you kind of will go from the cane to nothing at all. Those transitions are not black and white. Usually, there's patients will drop using when they're stepping down in assistive devices. You'll go from a walker and using it during the day to say maybe I use the walker at night, I use the cane during the day, and then as you progress on, maybe now you just use the cane at night, and now you don't use anything in the day, that type of thing. So you'll kind of step yourself down in using an assistive device. Rarely is it just black and white where you just stop using it. Those patients that do just stop using it because I, we know you guys are out there and that you're doing it. You're doing yourself a disservice. If you are walking and you're limping at all, then you're needing an assistive device. That means that you're overworking your hip. That's why you're limping, because your hip cannot tolerate your full body weight that you're using, and so your body's going to lean to over to the good side to take work off of that surgical side. Uh, you're not going to want to do that. You're just asking for potential problems. I've had a recent discussion with a colleague of mine that's a physical therapist, and he's convinced that patients that run into difficulty down the road in their hip and increased pain and problems like that, it's because they advanced themselves too quickly and moved from a walker to a cane too fast, or moved from using an assistive device to not using an assistive device too quickly. So you're not going to want to move real fast through that process. You have to. It's your hip replacement is a major surgery. You have to let the hip heal. Okay, and like in this area, we have a surgeon who he is adamant that that his patients stay on a walker out to 3 weeks, and so the no questions asked. He will not let us advance those patients. So you are doing yourself a disservice by moving yourself through that process too quickly. So that's kind of another component of safety that people don't often think about. Everybody's obvious about the falls and using assistive devices to protect that hip and stay safe and not do anything to disrupt that surgery. But people often don't think about the problems of overwork and what that actually does to that hip, and you are not protecting it. You're not staying safe with it if you are advancing yourself too quickly or if you're overworking that leg. Um, so that leads us into the third thing that really one of the most important. Like really, none of these I can't say are the most important. They're all really important for a successful hip replacement recovery, and that's going to be walking. You're going to want to frequently walk at a low intensity. I'm not talking about getting out and going walking around your neighborhood. I'm talking about just early on, starting with just walking in the house about every 30 minutes to an hour, especially when you first come home. Your sitting is going to be the worst thing you can do. It'll make your hips stiff, and you're going to have more pain when you get up and move around if you've been sitting for long periods. So, about every 30 minutes to an hour, generally about say 10 to 12 times a day, you're going to want to get up and move in the house, just walking, doing low intensity movement. Now, I'm not talking about going to get something to drink, going to get something to eat out of the kitchen, going to the bathroom, all of those things. Those are all activities of daily living that you're already doing. So those don't count. We're talking extra activity, and that extra walking, that hip to recover successfully, it needs the weight bearing that comes with walking. That weight bearing is what helps to stimulate the bone to grow. It stimulates your body to actually adhere to the component parts itself, to accept that joint so that you can successfully recover from it. So walking is critical for moving around, and probably it's as far as exercises go, I would say it's really the most important thing that you can do, especially early on, for a successful recovery of a hip. Um, And then that leads us into the fourth most important thing for you to be doing, and that is for you to be doing the exercises that your physical therapist give you. When you start in acute care, when you're in the hospital, you'll have a physical therapist generally come and get you out of the bed for the very first time, and they'll give you a few exercises to work on. Then you'll progress into home health typically, and home health will those physical therapists will give you more exercises, and then when you come into outpatient, then the outpatient therapist will progress you along with more exercises as well. It is important to do all of that. There's a reason that physical therapy is beneficial and that it helps, and that is because exercises and working those muscles will help you to recover. It will help, as I say, the bone to get stimulated to grow, and will help you to have a successful recovery. That said, the process of physical therapy, I would say hip replacements are generally so successful now that oftentimes they don't go to outpatient. I would say it's kind of 50-50 as to whether or not you'll go from your home health physical therapy over into outpatient physical therapy, because it's again, walking is probably the most important. I mean, that's not to minimize the other exercises that can be done, the glute sets, the heel slides, the, progressing and doing, sit to stands and all that type of activity. Those can be very beneficial as well, but, and they can help you to move through that process quicker. But it's not uncommon for a surgery or for a patient to return to their surgeon for the follow up to their surgery, and the surgeon may say, "Hey, you're doing so well, you don't really need to continue physical therapy, or you don't need, or just continue home health out until the end of that, and then you don't need to progress on." Um, Now, if you are a patient that say was highly functional before your surgery, if you're say maybe younger, and this is a surgery that you don't want to be too young for this surgery. If you're in your 50s, I would say you probably want to look at going into outpatient, because you want to get that as strong and as functional as you can be. But if you are, say, in your 70s, and you do work outside a little bit, you work in the home, and you maybe go out with friends some, or the family, but otherwise you don't, you're not too extremely physical, really, you may not need outpatient physical therapy at all. And you generally, as long as you're active and moving on the hip, it should recover very well. So, hip replacements in general are very successful. That's not to say that there aren't some difficulties you can run into with it. There are infections that can happen. There are There are infections that can happen. There are blood clots, the issues that sometimes patients will run into. But in general, having a hip replacement is a very successful surgery. It is generally the type of surgery that you will hear from patients saying, 6 months, a year down the road after they've had a hip replacement, or 2 years after they've had a hip replacement, they'll say, "Man, I wish I had done that sooner. I don't know why I let myself be in pain for as long as I did." I say all that to say, if you are thinking about having a hip replacement, um, they are generally very successful. Okay. If you've actually had a hip replacement, I would say follow those 4 points that we went over. Make sure that you are know what your hip precautions are and are following them. Make sure that you are staying safe and that you are avoiding falling or overworking your hip. So you're using your assist devices as appropriate. Um, and that you are walking frequently at a low intensity, and then just building on that over time, and that you are doing the exercises that your physical therapists have given you. If you do all that, you should have a very successful hip replacement the vast majority of times. As I say, giving respect to the folks that uh, uh, don't follow that path, because there are some that don't follow that path, unfortunately. But the vast majority of folks, they shouldn't have any issues if they will follow those 4 points. All right. Well, I hope that this video has been beneficial for you. If it has, if you would hit the like button at the bottom here. If you haven't already subscribed to the channel, then I ask that you subscribe to us. We're at this channel. I'm trying to talk about giving commentary on different physical therapy things. I've been pretty heavy in knee videos, but I'm trying to kind of branch out from that because there's physical therapy runs the gamut of shoulder issues, neck issues, back. There's all sorts of things that I still want to talk about and discuss. And so, if you are interested in this type of information and this type of channel, learning about different ways that you can heal from injuries or prevent injuries and those types of things, then please subscribe to this channel. And if you have any questions or comments, then put those down below, and we'll be saying prayers for you that things go well, especially if you're somebody here that has recently had your hip replaced. So do those points that we talked about, and things should go really well. But y'all have a good one, and we'll catch you next video. Later.